Welcome everyone to This Explainer. Today, we're diving into something truly fascinating. We're going to look at a professional visual CV that maps out the profile of an incredibly elite hybrid talent in modern medicine, Dr. Basheer Abdullah Marzoog. We are stepping right onto the bleeding edge of healthcare today, exploring what it looks like when a physician-scientist doesn't just understand the human heart, but also the artificial neural networks required to decode its absolute most complex data. It's an amazing journey, so let's get into it. To really understand this transition from medical practice to digital healthcare, here is our roadmap. We'll be covering 1. The physician-scientist profile, 2. Academic and clinical foundations, 3. Pioneering digital healthcare, 4. High-impact research metrics, and 5. Innovation and real-world impact.
So, starting with Section 1, the physician-scientist profile.
Have you ever wondered what actually happens when deep, bedside clinical expertise meets the raw, predictive power of machine learning? Well, Dr. Marzoog's personal statement serves as the ultimate thesis for his entire career. He isn't just casually picking up a coding language on the side. He is a fully realized dual threat. He's pursuing his candidate of medical sciences and cardiology, which is the PhD equivalent in the Russian Federation, and he is doing it with a flawless 5.0 out of 5.0 GPA. He perfectly blends traditional clinical study design with advanced machine learning methods.
And when we look at the sheer breadth of his foundational credentials in his dossier, you literally can't miss the languages. Operating with native or fluent proficiency in Arabic, English, and Russian, while currently learning German, isn't just a fun piece of trivia. This is definitive proof of his ability to seamlessly navigate, communicate, and solve problems in highly complex, multicultural academic environments all across the globe.
Moving on to Section 2, academic and clinical foundations.
Because before anyone can pioneer advanced digital healthcare, they need absolute, undeniable clinical competence. Simply put, you have to know the medicine before you can code the medicine. And that brings us to his incredibly rapid academic progression. He started his MBBS in medicine at Mordovia State University in 2017, graduating with a stellar 4.9 GPA. Then, he immediately transitioned into his PhD program at the prestigious Sechenov University, which he's expected to conclude in 2026. But I want to point out 2022. He completed a digital marketing certificate right in the middle of medical school. This is such a brilliant early hint at his modern, multidisciplinary mindset. He clearly understands that reaching people and organizing digital information is just as critical as the science itself.
And this solid foundation means Dr. Marzoog is, first and foremost, a hands-on doctor. Reviewing his core clinical research skills, we see study design, protocol development, and actual patient recruitment. This proves he isn't just a data theorist sitting behind a screen crunching numbers. He actually understands the real-world life cycle of a clinical study, from writing the methodology to physically collecting biomedical data from the patients themselves.
Which brings us to Section 3, pioneering digital healthcare.
Let's face it, modern cardiology is currently drowning in a massive ocean of data. Hospitals have terabytes of information, but they desperately need hybrid problem solvers to make sense of it all. Dr. Marzoog beautifully bridges this gap. He pairs traditional medical skills like bedside manner, protocol development, and patient enrollment right alongside cutting-edge digital AI skills, building reproducible data sets, running classical biostatistics, and creating full-blown machine learning pipelines. He literally carries the clinical reality over into the digital realm.
Let's geek out for a second on his advanced tech expertise as a junior researcher at the Center for Digital Biodesign. He isn't just using out-of-the-box software. He's actively involved in database development and cleaning. He runs regression and hypothesis testing. Even more impressively, he's developing machine learning models for risk stratification and validating those ML pipelines using rigorous metrics like area under the curve, sensitivity, and specificity. He's essentially mathematically proving that his AI models can accurately predict patient outcomes. When reviewing his specific work experience, we see exactly how he translates raw clinical data into digital biodesign. He takes messy, real-world hospital data and structures it into clean, reproducible datasets. Then he prepares publication-quality figures and tables. He is, for all intents and purposes, the human translator between the cardiology ward and the AI neural network.
Now, for Section 4, high-impact research metrics.
In the academic and medtech worlds, talk is cheap. Numbers, citations, and peer-reviewed output are the ultimate proof of a researcher's real value. And you can see this incredible consistency across the major academic indexes for him. 601 citations on Google Scholar, 440 on Scopus, and an H-index of 13 across both. That means he has at least 13 distinct publications that have been cited by other global scientists 13 or more times. For a young physician scientist who hasn't even finished his PhD yet, this is a remarkably high-impact metric. His work is heavily relied upon by scientists globally.
Over 80. That is the number of his publications. And we aren't talking about simple opinion pieces here. His publication volume spans incredibly complex, dense topics ranging from myocardiocyte autophagy, which is how heart cells clean out damaged components, to the very real impacts of COVID-19 cardiac injury. He is producing vital, potentially life-saving research at an astonishing volume.
And his caliber becomes even clearer through his peer review and editorial activity. He actually serves as an editorial board member for more than 5 journals and acts as a reviewer for heavy-hitting publications like Scientific Reports by Springer Nature, Cardiovascular Diabetology, and Cell Communication and Signaling. Over 69. And keep in mind, these aren't publications, these are verified peer reviews. Think about what that actually means. It demonstrates that the global academic community deeply trusts his critical eye. They actively rely on his dual expertise in cardiology and biostatistics to gatekeep and elevate the science being published by his peers.
Finally, Section 5, Innovation and Real-World Impact.
So we've seen the education, the skills, and the metrics. But what are the tangible end products of all this dual expertise? Operating out of the Institute of Personalized Cardiology at Sechenov University, he's basically found the perfect high-tech incubator. In this environment, successfully bridging the gap between raw clinical data and actual patient outcomes, he developed more than 7 distinct biomedical databases in just a single year, between 2024 and 2025.
But here is the crown jewel. A 2025 registered patent for an AI-based ECG and breathomics diagnostic software. This is the absolute synthesis of his skills, representing the bleeding edge of diagnostic technology. He's taking traditional cardiological signals, combining them with novel breathomics data, which is analyzing the chemical makeup of a patient's exhaled breath, and running the whole shebang through advanced diagnostic algorithms that he personally helped design and validate. It's just phenomenal.
So I want to leave you with this final thought as we wrap up this explainer. Look at this entire trajectory. Look at his transition from classical medical practice to advanced machine learning architecture. If you're a recruiter, an investor, or a medical director, you really have to ask yourself, is your institution ready for the future of personalized cardiology? Because innovators like Dr. Marzoog are already out there building it.